Hi, I'm Hannah Kuhn. I am a child life specialist and I have worked here at Texas Children's for almost 8 years now. I became a child life specialist because I always knew that I loved kids.
My name is Leslie Chong and I've been a child life specialist at Texas Children's for 25 years. I chose to become a child life specialist because I was really interested in working with children, but also had an interest in the medical field as well.
My name's Kaylee Kolnhofer. I have been a child life specialist for 20 years and I've worked at Texas Children's for 13 and a half years. I think one of my favorite things about being a child life specialist is seeing kids overcome really hard things.
I'm Mary Tegens. I'm the Assistant Director of Child Life Creative Arts and Education, and I started in 1989. I feel incredibly lucky. I can still hear a story from Texas Children's or see a commercial and feel some emotion well up in me.
A child life specialist is somebody who helps patients cope with being in the hospital. We help patients understand why they're here. We help them understand what their treatment is going to look like.
I think sometimes people just view child life as the fun people and that we do a lot of play and just dropping off activities, which is a part of our job, and play is very important for kids.
We have our bachelor's degree and many of us have our master's degree as well, and that's usually in child development or education or psychology or a similar type of field. And we also have to do an internship under the guidance of a certified child life specialist so that we can qualify and sit for the national exam that helps us, have our certification.
So we are able to adapt the language of what the high-level medical terminology is into patient-friendly language and communicate that to the patient so that the patient is more cooperative with their care.
And so just helping them understand what that experience is going to be like through pictures and through some medical play.
Play is somewhat our superpower in this department.
Our play can be a lot of other things like expression of feelings and being able to process what the kids are going through and giving them some control where maybe control is taken away.
So it looks like we're playing with the patient, we're laughing with them, we're helping them to have fun. But in my head, I'm assessing child development. I'm figuring out, are they at the developmental level that I expect them to be? And if not, can I adapt my education and my preparation to meet them where they're at?
One of the things that I love the most is being able to see that connection happen and for them to be able to begin to trust the environment that's around them, to help them trust the nurses and the doctors and all of the medical personnel that are here as well.
These families and these children are going to cope so much more effectively when they're managing their emotions, when they're understanding what's happening, and when they're able to ask questions and feel heard and be recognized that wherever they are in their journey is the perfect place for them to be.
The way Texas Children's is structured is we have child life specialists across the whole system, and so maybe a patient meets me in an outpatient clinic and I support them during a procedure, and then a couple weeks later they have to get admitted for something. They're already familiar with child life, so then they can ask for that inpatient.
We're also in areas like the NICU with the babies, where we do a lot of support for families and siblings, helping support infant development in that area. And then we're in the emergency center.
And so then we have that continuity of support across the whole system, which I think is really beneficial.
In this role, it really is about finding joy.